Hi, my name is Nia, and today I will be demonstrating oropharyngeal suctioning procedure. And one of the first things I want to do is gather my supplies. Once I've gathered all my supplies, what I will want to do is, let me show you my supplies, I have some saline. I have like a little basin here, a plastic basin to put my saline in. I have some gloves with me, and I have my tubing for the suctioning procedure. So once I've gathered all those supplies, I will head to the patient's room and enter the patient's room. I will introduce myself while providing the patient some privacy. And once I do that, I'm going to wash my hands and make sure that I'm identify the patient with at least two identifiers, which would be their first and last name and their date of birth. So now what I will want to do is once I've identified the patient, I just want to explain to the patient what the procedure is going to be and what it's going to entail in detail. And if the patient has any questions, I can actually answer those questions for the patient and make them a little bit more comfortable with the procedure. Now that I've done that, I'm going to place an oxygen oximeter on the patient's finger, and that's going to allow me to monitor the patient's oxygen saturation while performing the procedure. So now that I've done that, now what I want to do is put the patient in a semi-Fowler's position. With my little Cookie Monster here, I'm going to put her in semi-Fowler's position, just to raise the bed up a little bit to perform the suctioning. So once I've done that, now what I want to do is drape the patient with some protective gauze or a little cloth. So I'm going to use a little paper towel for that. So once I've done that, I'm just going to cover the chest and you want to cover the neck. So I've done that. So once you do that, I want to don my hands with my gloves. Sorry, it's a little tricky. Sometimes I have problems with these gloves. Alright, so now that my gloves are on nice and tight and interlock my fingers, you can also use a face mask, a little protective covering for the face, just in case you have any splashback. And also you can use this to protect the patient from any bacteria from breathing down on the patient that can get into their suctioning area. So you can put that on as well. So once you've done that, don your gloves and put on your face mask. Now I'm just going to get my sterile saline and I'm going to pour a little bit of that saline into the basin. And then once I've done that, I want to get my tubing and I'm going to connect one end of the tubing to the suctioning machine. And once I've done that, once you connect that, now I have my catheter here. You're going to connect your catheter on the end of the tubing that's going to go inside of the patient's mouth. So now once I've done that, to make sure that the tubing is patent, what I'm going to do is first, I'm of course turn on the oxygen, and what I'm going to do is I'm going to put this here inside, and once I see that inside the saline, and once I see that some water is suctioning within the tubing, now I see that it works. Now what I want to do is after testing the tubing, it's of course now safe to proceed with the procedure. And what I'm going to do is I'm going to have the tip of the catheter, and I'm going to place it into the patient's mouth, and of course get the secretions out. But what you want to do, if the patient is wearing a nasal cannula, you want to keep that in. You don't want to take that off. And if the patient is wearing an oxygen mask, you want to put it to the side of the patient, and change it later on after the procedure. So now that I've done that, I will proceed with the procedure, and I'll put the catheter in the patient's mouth, starting at the gum line and working my way towards the pharynx. So I'll start here and work your way towards the pharynx. And when I'm doing that, you just want to be gentle, making sure not to hurt the patient. And now you just want to go around the mouth and suck all the secretions as much as you can. And you can also encourage the patient to cough as well. This will help some of those secretions come up, so you can actually suction that into the tubing as well. So once you've done that, after you've finished suctioning the patient's secretions, it's time to clean the catheter and the tubing. And to do that, we can do this what we did in the beginning, and we can actually put this tubing and the catheter into the basin where the saline is at, and it's going to actually help clean that tubing out as much as possible. So once you've done that, what you want to do is you want to detach the catheter and the tubing from the end of the suctioning machine, and you just want to place this catheter in a clean and dry area, mainly beside the patient's bed, in a little bag. That's what you want to do with that tubing, with that catheter, and place the tubing aside. So once you've done that, what you will want to do is once you put that aside, what you want to do is now you want to turn the machine off. Make sure the machine is off, that the oxygen isn't still running, and make sure once you've done that, make sure that the patient is comfortable as much as possible. And once you've done that, you're able to clean their face or any area that may have gotten a little dirty while you were doing the suctioning. And if the patient has any other needs as far as hygiene wise, you can do that as well now as well. Now at this time, it is important to ask the patient if the patient is breathing properly. Ask them, has the suctioning actually improved their breathing? And if not, you just want to make sure that you do whatever you can in that moment to actually help with the breathing process. And after that, after you're done asking the patient questions about the breathing, now it is okay to actually ask them, take this away too, their towel. Ask them if they want their beds to stay like this, or if they want to go down a little bit more, anything that will make the patient comfortable. So once you've done that, you just want to discard all of your supplies that you have. You want to take off your gloves, of course, and discard those as well. So I'm going to take off my gloves. Take off your glove and dispose of those. And once you've done that, what you want to do is you want to document. You want to document the color, the consistency, and you want to document the smell. Before that, you want to perform your hand hygiene and then document. Hand hygiene, and then you want to document the procedure as far as the color, consistency, and the odor of the secretions. And once you've done that, Once all of that is done and your documentation is set to go, just make sure to ask the patient if they need to use the restroom. Put all the personal items as close to them as possible, and make sure that the call light is there. And just tell them, hey, I'm right outside the door or in your area. If you need anything, just let me know. And that is how to perform a oropharyngeal suctioning. Thank you.